Hello, everybody, and welcome to another episode of The Male Perspective. I am your host, Lana Reid, and today I have the pleasure of speaking with Mr. Alex Yarijanian. He is the founder and CEO of Carenodes. And thank you and welcome to the show. Thank you for hanging out with me today.
Thank you so much, Lana. I appreciate it.
Alrighty, so today we're going to talk about you guys, men, and why you guys are a little reluctant to go seek medical care and mental health care. And according to this article that I pulled up on Healthline, it says that men are, there was a survey, 72% of the respondents said that they would rather be doing household chores like cleaning toilets than going to the doctor. And 65% of the respondents said that they avoid going to the doctor as long as possible. And when it comes to your mental health, it says that according to the American Foundation of Suicide Prevention, men died by suicide at a rate of 3.54% higher than women in 2017. And depression and suicide are ranked as a leading cause of death among men. And yet you guys are still less likely to seek mental health treatment than women. So Alex, why are you guys so stubborn?
Well, who to blame, right? That's the
Why would you guys rather die the noble death with one limb hanging off instead of finding out all you had to do was change your diet? It doesn't make any sense.
Yeah, it doesn't. It doesn't make any sense, but it makes all the sense. Because when you look at, something like a mental health issue, we're kind of expecting the person who's suffering from that issue to be self-determined and to kind of know that they have a mental health issue in the first place and go and now find care, figure out who's in network if they're covered, figure out how to get an appointment. It becomes such a process that honestly, I feel like the system kills us more than we kill ourselves.
Okay.
And it's not just a problem with men, but absolutely it has a cultural element to it. For example, you see more depression showing up in the primary care office as a headache than you do, directly calling the counselor.
Okay.
For instance, addiction issues are rampant, yet there's no real kind of clear way of seeking care. For example, I'm in healthcare. I've been in healthcare for many years. I ran 28 clinics across California and Texas, primary care, mental health, substance abuse treatment services, 14 hospitals, over 50 skilled nursing facilities. I worked at Humana as a national health plan, as a contracting and network management person for Hawaii and Nevada. And yet, we continue to see access issues in terms of cost. So when you have a high deductible plan, and your psychiatrist is $400 an hour, guess what? If you have a deductible of $1,000 you have not yet met, you're paying full out of pocket for that $400.
Gotcha.
Whereas Christmas, I want to buy my nieces, my nephews, my kids gifts, right? So you have to start to ration your care. You have to kind of navigate a complex system while you're experiencing all these issues.
Okay.
It's such a challenge to kind of drill down to a single root cause. I feel like mental health has been so traditionally carved out of our understanding of health. And now we keep saying, oh, integrate. It's become a buzzword that has not been implemented at all. Okay. Because still the dollars, you have to follow the money, right? So there's multi-billions of dollars. They funnel through different channels. So your physical health is through someone else, some other health plan, some other insurance company, and your mental health plan is through another one. So these two don't link up. And so you have a fundamental disconnect right there.
Okay.
And so it's a systemic issue, it's a social, cultural issue, and it's just so multifaceted that I feel like we're not catching up to the epidemics until way past due. For instance, we talk about opioid epidemic killing people. Wow. Okay, well, are we surprised? I mean, when you're looking at, right now, marijuana legalization in California and other states. Now, I'm for that. I feel like people should have choice. At the same time, I feel like there should be resources, right? Because we know that people are prone to addiction. Some people are prone to addiction, whether it's marijuana, whether it's chewing on a pen, whatever. So if people come out and say, oh, marijuana is not addictive, it's not addictive, and like, swear by it, there are people who get addicted to anything, right? So when you're walking to a shop and you're in California, we're paying 35% tax on these material.
Mm-hmm.
Where's that money going?
True.
Why isn't there a 1-800-NO-POT line that I could call if I wanna stop smoking on the vape? That's
Yes.
80-90% THC.
Yes.
How do I get help?
That's
I
true.
don't until 10 years later. Oh my God, it's an epidemic. How did it happen? Well, this is how it happened. There was no resources
Yes.
provided. You go to a store, here's your product, just how there are cigarettes. Here's your cigarette product. And also, by the way, it's bad. And here's a number you could call if you need help. Where is that resource for instance, marijuana addiction, which also triggers other, manifestation of mental health issues, for instance. And again, not all, but there are instances. And if we could mitigate those instances which hit socially disadvantaged populations first, which is so messed up, which is what perpetuates the issue, then we need to be able to have a greater discussion. And it's like, okay, well, we always say that, and then now it's 2020, and then it's 2021, and then
And
it's
we're still
2025.
talking.
And we're still talking. My mouth hurts.
We're still having the conversation. I want some action here. I want some action. Now, you mentioned a couple of things I want to zone in on. You mentioned that it was systemic, and then you mentioned that sometimes it's cultural and socio economic. And I really kind of want to touch on that because me being a Black woman, I see a lot of men of color that have depression, mental health issues, but culturally, we don't seek the help because we don't have the economic resources to seek the help, like you mentioned. And then we have there's a stigma for a lot of people of color, not just Black people, but any person of color to actually, I'm going to sit down and talk to a shrink about, why I didn't feel like getting up and going to work today to feed my family. There's such a stigma on manhood, as far as seeking mental health. Do you see any way, because you've been in this industry for a while, have you seen any successful ways that we can start to kind of, it's okay, nobody's going to think less of you. You can go get the help.
Yes, there have been models. There have been models that have been successful. For example, in central LA, there is you don't need to meet these guys where they are. You need to meet anybody where they are, but especially with the population, for instance, barbershop, right? Barbershops. There is a program around diabetes education. And, disproportionate amount of the African American community, which is not a homogeneous community, suffering from diabetes and these types of, chronic conditions. That with just perhaps some education, the theory being, you don't know what you don't know. So if we give you a little, education, then perhaps you can better identify, you'll have at least the tools to make your decision. There is no need to be condescending. These are the options. This is what the situation is. You let the man make that decision. Now, at a barbershop, what better place than to embed, for instance, some kind of counseling, some kind of strategy to meet that person where they are. Because we're assuming that person knows to then go and seek mental health. Because they're going to have different perceptions. What is mental health when you ask? Oh, they might be thinking of a psych ward, right? I'm going to a shrink. I'm not seeing things.
Yes.
I'm not hearing things. Why do I need to see a shrink? So it's kind of such a complex issue that it's hard to come up with one single strategy that's going to address everything. I think we need to see, what are the behavioral habits of a, X kind of demographic, and how could we best integrate into their lives? How could we make such care available at work? Promote telehealth. For instance, if you feel like this and like that, it could be short-term depression, normal. Pick up your phone and, you can connect with a therapist, and the one that looks like you, one that, you get to choose, and there you go. You could get on some kind of a, talk therapy. And we need to allow more diverse folks coming into this profession, because that's another issue. I'm not seeing, the higher you go up in the ranks, right? For instance, you'll see a lot of LMFT, so like the basic counselor, right? They look like us.
Mm-hmm.
But as you go above, you hit the psychiatry,
Yeah.
everybody starts to look the same.
Yeah.
Now, it doesn't have, we don't, again, I hate to sound condescending. We don't have to all look alike to know that we're, but still it makes a difference, right?
Yes.
Because it could be perception of, oh, this kind of treatment is for those people, not for me. I don't need medication. I don't need this and that. But how do we diversify the understanding of different types of treatment options?
Yes.
We have to first have the person know that they need treatment, and that it's okay. And that's a hard thing to do because you have to reach them where they are, and you're going against the grain. You really are.
Yeah.
It's
You know,
complex.
and one of the things that I have experienced with friends, family members, and this is of men of all colors, is sometimes I notice you guys will tend to self-medicate, right?
Yes.
Be it drinking, be it gambling or whatever. And me being a loved one, and I'm noticing this, and I'm trying, buddy, dear friend, maybe this is something else. Do you want to explore? No, I don't even talk about it. Nope, nothing's wrong with me. How do we, as the loved ones around you guys, kind of, tap you on the shoulder and say, you want to look at this, maybe,
Wow. That's a good question.
Yeah.
That's hard. Because I've suffered similar issues.
Yeah.
And that's really hard. When you could be a high functioning person
Yes.
and suffer from multiplicity of issues that are like, so, whoa, I would never expect you suffering from that.
Yeah.
That's a really, really good question. I think that, as I and try to come up with a good answer, I feel like if it comes from a place of the heart,
Yeah.
that could make some headway. Ultimately, situations are so, case specific
Mm-hmm.
that it's hard to come up with a general framework or general, cookie cutter approach. Because addiction is something that, plays on your, physiology. And it's sad because once you hear about, for instance, I used to smoke cigarettes, right? Now. And so the messaging would be, oh, once an addict, always an addict. It changes your dopamine pathways. And you start to hear things that are kind of like really disheartening. It's like, oh, okay, forever I'm going to be this way. And it's like, I think being non-judgmental is the first thing towards, first step towards any kind of family intervention, if you will, or, talking to your loved one. Listen, I'm here to support.
Mm-hmm.
I'm not here to judge you. I know that you're you no matter what. Let me know if there's anything I could do for you. And I love you all the same.
Mm-hmm.
I think if the behavior becomes destructive, then perhaps it's different. And when I mean destructive is, kind of danger to others, then that's a different discussion to have. But I would say if it was me, I would want some kind of a compassionate approach, perhaps. And, I'm here to help. But I mean, if you don't recognize it's a problem, then that already seems like an intrusive approach. If you don't think that's a problem, then it's like, I'm doing my thing, you do your thing.
Mm-hmm.
And you don't want to push them away, right? Where they're hiding from you their patterns because they will.
Yeah, because I'm thinking, looking at all of the impressive stuff you do some work with the epidemic, the opiate epidemic. And I want to kind of extend it out there, extend myself and say that might be, or it is, a layer for other issues, other problems, right? And so being the loved person, the loved one around that person who is suffering from this addiction that is really a serious crisis today, it's a lot of pushback. I got this, I could quit anytime. I don't, but we have a problem here and we need to address this.
What I would recommend is for caregivers or, loved ones to seek that counseling help themselves.
Mm-hmm.
Because what you need to do is make sure that you're okay, because you can't help anybody if you're not,
Okay.
So if you're coming from a place of frustration, if you're coming from a place of, you're doing X, Y, Z behavior and you're doing it wrong, and I have that in my heart, but I'm approaching it as I'm trying to help you, then that is not the approach, right? Okay. The approach is really to seek help yourself, and your insurance should be paying for that. If not, you call me. And I will call people, because they should be paying for you to manage, first of all, your own self.
Okay.
There are certain practical steps that you should be taking. So, for instance, if you have a loved one who is experiencing opioid addiction, whether it's heroin, pills, whatever, you should really have naloxone at home, where it's a immediate reversal of overdose, and every ambulance, every pharmacy, every provider is supposed to already have that injection. And all you do is you inject and you save your loved one.
Okay.
Because last thing you want is the loss of a loved one, especially in your hands. They're lying down here on the couch at home and they're gone. Where if you had that shot, you could have saved them.
Gotcha.
So there are practical steps to take, and they're also kind of you have to make sure that you're okay first.
Gotcha. Understood. Now, I'm a military brat. I grew up overseas, and
Happy Veterans Day.
thank you. So I have learned that other countries do a lot better when it comes to medical care and mental health care. And it seems like here in the United States that we should be at the forefront. We should be movers and shakers. We should have this down pat. But it seems to be a struggle for us to make sure that our people have access financially to medical care and mental health care, which I read is one of the reasons why a lot of men and women, but men don't seek it because it's just too much. It's out of pocket. I need to spend that money. Like you said, do I want to buy Christmas gifts or do I want to, so what, and it's a struggle. You hear everybody talk about it. What changes do you see we need to make mental health care, medical care accessible for people?
Accountability.
Yeah.
Accountability. I mean, there are laws on the books. For instance, the Affordable Care Act, aka Obamacare, the Affordable Care Act strengthened certain laws on the books. Now, I don't want to lose people, but this is important that it's called parity, mental health parity, meaning your medical benefit package is by law supposed to equal your mental health and substance abuse benefit package. Because historically, I mean, this was 2008. It's not that long ago. When you talk in terms of huge, $3.5 trillion industry trying to move, right? So that's not a long time ago, 11 years.
Yeah.
So essentially the way the systems have been set up is that, you have your medical care and then your mentals from somewhere else. Previously, you had to purchase it separately. It wasn't included. Law requires that they're included. And so if you're paying a copay that's higher than your physical side, that's a parity issue. That is something that you can reinforce. But the thing is that all of these take knowledge as to how to navigate these systems, as to how to write a nasty letter, as to following up on these letters, you need an assistant to help you with all that. I don't want to discourage folks from, raising their voices at the system, but it becomes an issue that you need to first know that if you feel like there are more, dietitians in the network than there are counselors, that's a problem. If you're paying if you think you have to pay a cost share, but if you're on a Medicaid plan, you are no cost share. So you shouldn't be, nothing should be coming out of a pocket for you.
Okay.
If you are, these are some things that you should know. I feel like people don't know, but it's really hard, who's in my health plan network. By the time you do all that, you're more depressed.
Yeah.
You don't want to reach anybody. It's like, what are you going to do? Open up Yelp? Okay, well, those reviews are those crazy people.
And it's so overwhelming. You get open enrollment and you get this book that's this here. You're like, okay, well, what, and the whole process is just so, they need to break it down to kindergarten, elementary chunks so the masses of us can comprehend it. It can be, the whole process can be overwhelming. Like I said, like you were saying, if this is included, but a lot of us just don't know that that's included.
No. And guess what? We're paying for it. Taxpayers paying for it. Your employer's paying. You're paying for it. And so you're entitled to that. You're entitled to that. You should seek it aggressively. Now, again, it comes back to you knowing that you need mental health care, and it comes back to you having enough self-agency to go ahead and pursue the system.
Okay.
So I think it's important that, because this could become quickly overwhelming, like, okay, we've been on this show for X minutes, and what's the answer? Well, I think we need to provide, first things first, suicide hotline. That there is suicide prevention hotline, 24 hours. Again, It's paid for. Please do access it.
Mm-hmm.
You know, that is some concrete piece of information that audience could, have at their disposal in the event they're feeling, as if they might need that help. So I want to make sure everybody has that resource.
Okay.
There's also SAMHSA, and I'll send you those links so that you
Okay.
can,
I'll put them in here.
exactly, yeah, which is the Substance Abuse Mental Health Association. Basically, it's a federal association. It's a federal body that's responsible for making sure everybody has access to those resources.
Okay.
Now, how accurate they are, well, that takes some, you got to do your due diligence. But, I want to offer myself as a resource too. I mean, if anyone's stuck in that loop of the system, which is going to be a lot of people,
Yeah.
but I have to, but my heart says, reach out.
Okay.
And I will help you navigate some of these things, some of these systems.
Okay.
But again, it comes back to that person knowing that they need help
Okay.
and actually seeking
Okay.
that help. And, I'm not a behavioral health specialist, but there are these kind of folks. And, calling that 1-800 number will also, you can ask, hey, what counts? If you have an employer insurance plan, then you are likely to have what's called Employer Assisted Program, EAP, which is no cost to you. Well, no cost to you to pay copay or any of that. Basically, it's a confidential series of sessions that your employer will authorize, and you could get connected with a counselor. And it's for short-term resolution. If you're feeling stressed out, if you have for instance, it's happened to me that if I had 7 different bosses in a year and 11 months, that's stressful.
Mm-hmm.
Because I feel like, I'm spending, every time someone comes with new
work
attitude,
styles and everything. Yes.
yeah, it's like, wait, this expectation was from you or 5 people ago? So, it's my livelihood.
Yeah.
And you guys are rotating above me like, the cups of coffee I have every day. And so, those are some resources that are available to you. You connect with HR, you say, I want to access your, our EAP, Employer Assisted Program benefits. You need to give them no additional details, and they should authorize those benefits for you. And you won't pay out of pocket for those. Usually it's 3 sessions they'll authorize, and then, you could talk to your therapist about, whether you need more to be authorized. And those have been, I've used those services before, and they've been effective.
Okay.
And so, it'll be on your time after work or whatever, during lunch, whatever it is you want to schedule, and you'll be able to access those benefits. I think that's a good point for those who are employed. But those who aren't, or their employer doesn't offer those benefits, and many people, then you need to, if you need to make sure you get on Medicaid if it's a state that, allows for that, and hold your Medicaid plan responsible. Okay. Because by law, they're supposed to give you access. Yes.
Now, you mentioned Medicaid, Medicare. There's you are the ambassador for Medicare My Way Task Force?
Yes.
Yes. So tell us exactly what that is, because a lot of people are walking around Medicare, Medicaid, whatever. So tell us what you guys do over there.
Sure. So, the basic difference between Medicare and Medicaid is, Medicare is for 65 and over. Mm-hmm. And Medicaid is for those who are below certain poverty line, as set by the Fed and the state. And it could, one person can have both Medicare and Medicaid if they're frail, over 65, retired, and also are not, are below certain poverty line. Now, what we do at Task Force is make sure, again, that these seniors are not taken advantage of, is, being a resource for the community so that we can, help navigate those systems and make sure that we're an advocate for these, these folks who we've paid tax dollars, they've paid tax dollars to have benefits, and yet, they're not receiving because it's so complicated, they're not receiving exactly what it is that they need. For instance, effective 2020, their health plans Medicare Advantage plans will start to pay for some services that are considered traditionally non-medical, for instance, transportation, access at home. So if you have, if you have a lift in order to get into your home with no ramp, well, you might be and there was a patient with this story. She would hurl herself in and then pull her wheelchair, and she would come to the doctor's office, and we would see, scratches on her knees and on her elbows, and first 2 times no one asked, 3rd time was getting worse. So we're like, what's wrong? So we sent some folks to the home, and there we go. There isn't ease of access. And so that $400 home visit and fixing of the lip versus tens of thousands of dollars for those emergency room visits. So these are kind of things we want to make sure that seniors know that they have. at their disposal based on their plans, and they need to select the correct plan so that they have access to things that are not medical directly but impact their health outcomes.
Mm-hmm.
So those are a lot of education is involved in that ambassador role.
Listening to you talk, it seems like there's a lot of benefits out there. There's a lot of things that people have access to and people just don't know. And
Yes.
that's just a simple matter of education. So I'm curious, why are people not being educated?
Because first of all, healthcare people need to know. And so it takes such a long time
Okay.
to trickle down. That's the thing. So
Okay.
something that's, available 2020, you'll find out 2025.
Uh-huh.
That's simple as that.
Yeah.
A lot of changes happen. They come up with thousands and thousands of pages of budgets and regs, legislation. Someone has to read that.
Mm.
I don't have time. And so I expect, for instance, the Medicare My Way task force to go ahead and read and then send me a summary so I could then educate people.
Yeah,
Mess.
Getting off of the topic of men, I'll talk about my mother for a minute. She just found out, she's 68 years old, and she just found out about the wonderful world of Humana. I'm not going to do the little plug, but for her it works. But she wanted to lose some weight. She's carrying some extra pounds, but she found out through Humana that they would pay for this program called Silver Sneakers and pick her up every day. And she was like, wow, this is amazing. Nobody ever told me. But it's just awesome, just like perplexing that the stuff is there, but nobody knows.
And you got to go find out.
You got to
go and find out. There are a lot of barriers to finding out. And so thank you for bringing that up. Now, it's not an endorsement for Humana.
Not an endorsement.
It's an example. I'm glad your mother.
just as an example. I was just, but yeah, she was just like, I never knew that. And they come and pick her up and take her. She goes and works out in the morning, and she's just a happy camper all day long.
I'm happy to hear that. Those are the good stories.
Yeah, So before I do my random question of the day, I want to talk about your company, Carenodes, because I looked at it. It's not my forte, but it looked impressive. So I want you to explain to everybody what it is that you do over there.
Sure. So Carenodes makes healthcare operations easier. Right now on the back end, where customers don't, or general population doesn't see, there's a lot of paperwork on the back end. I mean, I know, as patients, we encounter the paperwork, but as healthcare administrators and people on the back end who are typing, multiply that paperwork, thousands and thousands of pages a month. And so what Carenodes does is it aggregates and kind of organizes all the data that comes in, whether through email, whether through paper, fax, mail, so that we can have the healthcare provider who's sitting up in Prompt, Nevada, who's the only provider within 60 miles in rural America, being able to manage all the paperwork that we expect of metro providers who are well-funded, above the billions, and still dealing with those issues, but at least they can hire 10 people to try to manage it. And so what this does is it allows, no matter how big or how small the provider is and your primary care is, they'll be able to manage all the paperwork and all the preventative care opportunities that come their way, but they cannot reach those patients because of the just sheer volume of data that's disconnected and it's in different forms. So if I'm getting, hundreds of pages of patient lists in the mail, then it's hard for me to type that up and send it to different clinics. So why don't we digitize it and allow for what's already available to be applied in healthcare? And so that's what Carenodes does.
Okay, awesome. Now you mentioned the medical care provider, and that was one of the questions that I wanted to ask. So we're going to circle back real quick, and then I'll do my question of the day. As far as men in healthcare and seeking healthcare and mental health care. So let's say the loved ones manage to, push the guy into the doctor's office. We actually get him there. What on the medical health care provider, the staff, do they have to do anything on their end to make it as comfortable as possible experience so that we can get the guy back in there before another 10 years passes by? Is there anything that the medical staff can do to?
Sure. Check in with the guy using his text messaging, using his phone. It doesn't have to come in right away, right? You could do annual screenings, and the healthcare provider could bill for that separately, and the patient won't even have to pay because that's prevented. Again, Affordable Care Act mandates preventative care and mandates that the patient is not charged for that. And so, healthcare provider could send a survey. There are standardized surveys that test for depression, test for alcohol abuse, and all the patient has to do is yes or no, respond, or click on few responses.
Mm-hmm.
And if it's a positive result, meaning perhaps substance abuse is detected, then 15-minute phone counseling automatically, or 30-minute counseling and referral to treatment. This is best practice that your primary care should be implementing.
Okay, I can see the male ego biting on that a little quicker than trying to get into the doctor's office. So
that's correct.
Okay, so we're going to do the random question.
Let's do it.
Random question here. Let's see what we got. What is your least favorite food?
A calamari.
You don't like the calamari? No squids for you.
No squids for me. That's the first thing that came to mind.
Calamari. Okay. All right. So before we get out of here, I want to let everybody know we only talked about one of the things that you're involved with, but you are also connected to a couple of other things. Pledge LA,
yes.
And that's diversity in tech, right? So
that's correct.
And then you have the California Health and Advocate. Community health centers, that might be a very good resource tool for, we talked earlier about different socioeconomic communities and cultural communities, right?
Yes.
And then you're also on the National Academy of Medicine Action Collaborative, the Opioid Epidemic Response?
Yes.
What do you guys do there real quick?
Well, we get together and try to pool resources and share best practices, so we're not spinning our wheels in our own silos, because being a hamster is not getting old.
Oh yes.
So, well, let's many in body, one in mind. We're stronger together, and that's the idea.
So if anybody has any problems, it's open enrollment time. So if anybody has any problems reading their package, they can contact you.
And I will refer you to the right person. Yes.
So how do we get in touch with you, dear?
My email address, alex@carenodes.com. Is my direct email address, and feel free to reach out on LinkedIn or on my email, and I'll get back to you. And I'll make sure you have all that information so we could.
I'll link it on the video. Okay, so until such time, I'm just going to continue with my normal guilt trip. All my male friends and all my family, I say, if you love me and you want to be around for a long time, I don't see why you don't want to go to the doctor if you love me. I'm just going to continue with my guilt trip, and hopefully
that works. You know what they say? The man might be the head, but the woman's the neck.
Yes, I'm going to keep on doing that.
That's from my Big Fat Greek wedding, by the way.
That's right. All righty, Alex. I've enjoyed you today. Thank you so much for the information. Until next time, everybody, this has been another episode of The Male Perspective. I will see you guys all next week.
Thank you so much.